Any major disruption to a community may require a public health response. Depending on the event, the health department will take either a supporting role or the lead role. For example, after major flooding, the county's Emergency Operations Center, the EOC, would coordinate rescue teams, first responders, and public utilities. Health departments would provide support by heightening surveillance for waterborne disease and providing advisories on boiling water. In the event of a deliberate release of infectious agent, such as anthrax, the health department would take the lead role. Whether the health department is managing or supporting emergency response activities, it will do so from the Department Operations Center, or the DOC. The DOC can be a physical space, such as a designated room, or a secure web-based application, such as Web EOC. Every county has its own way of bringing its health personnel together to manage an emergency response. DOCs provide a central point for managing information, getting the right information to the right person in a timely fashion, providing situational awareness, getting a grasp on the severity of an incident, making decisions, setting objectives for the DOC's emergency response, coordinating and assigning resources, making sure that the appropriate people and supplies are available to meet the incident's demands, managing and supporting activities in the field, staffing POD sites, for example. Activation is when an incident occurs and health department personnel are notified to report to the DOC. Staff must stop what they are doing in their day-to-day roles within the health department and begin to think in terms of functioning within the incident command system. A health department's DOC may be activated any time an unusual event or emergency calls for a health response that exceeds normal activities, such as when a local or state emergency has been declared. Local resources are exhausted. Local resources cannot be filled through normal channels in a timely manner. An emergency extends for a long period of time. Major policy decisions are needed. The medical health branch of county or operational area emergency operations center needs assistance managing the incident response. Depending on the situation, a DOC may need to activate only a few staff to respond to a small incident, activate more staff to respond to a moderate event, or it may need to activate many staff to respond to a major event. These responses correspond to 3 activation levels. Level 1, Standby Alert. For situation assessment of small incidents, such as an outbreak of measles in a single facility. Level 1 activation may require only a few members of staff and involve 1 or 2 agencies. Level 2, Partial Activation. For moderate events, such as a facility fire resulting in evacuation. Level 2 activation requires minimal staff and may involve several agencies. Level 3, Full Activation. For major events, including regional disasters or an influenza pandemic, that require activation of large numbers of staff and the involvement of multiple agencies. Each health department should have its own procedures for activating the DOC and notifying appropriate staff. Do you know who is responsible for activating the DOC in your county? The medical director? The health officer? A department or division director? Who will staff the DOC? What is the notification process? Where to go if the DOC is activated? Is there an alternate site for the DOC? How and where are your county's procedures for activating the DOC stored? Examples of standard operating procedures for activating the DOC are available in the resource section.
Let's briefly review the Incident Command System, or ICS, and the key management positions within ICS. ICS is a standardized, best practices approach for managing decision-making, resources, personnel. ICS is the cornerstone of both California's Standardized Emergency Management System, SEMS, and the National Emergency Management System, NIMS. ICS can be used for all types of incidents, from small events to large-scale emergencies. Basically, ICS is a system for achieving order within chaos and for ensuring that different agencies can work with one another in a coordinated fashion. ICS is a formalized process that helps prevent duplication of effort, and conversely, it eliminates assumptions that someone else is doing the job by ensuring accountability. ICS is a command and control, top-down system with one person in charge. Or, in the case of large incidents involving multiple jurisdictions, the incident commanders will make joint decisions and speak as one voice. ICS is not the decision by consensus approach to getting things done that many health department staff use in their day-to-day jobs. ICS uses defined organizational structure, that is, modular configuration. Expandability and contractibility, that's organizational structure increases or decreases to meet the situation's needs. Clear chain of command, that's an orderly line of authority. Manageable span of control. A maximum of 7 staff may report to 1 supervisor. Optimum ratio is 5-to-1. Unity of command, that is, reporting to 1 supervisor. Receive assignments from only 1 supervisor. Management by objectives, identifying what needs to be accomplished. Integrated communications, radios and other communications equipment must be compatible so personnel can talk with one another. Common terminology.
Do you copy?
10-4.
That is, plain English and specific position titles, such as incident commander.
This is the incident commander. Did you get that?
Yes.
Under ICS, an emergency response is broken down into 5 key management functions. These functions apply to incidents of all sizes and types, from planned events to emergencies that strike without warning. The key management functions are management, planning, operations, logistics, and finance and administration. Many health departments use color coding to designate the 5 functional roles. In that case, emergency response management staff will wear a colored vest that corresponds to a specific section. The vest may also identify the title of the functional role. Color coding makes it easy to identify the ICS positions and roles of assigned staff. Color coding also helps provide security by quickly distinguishing who should or should not be in the DOC. Here is a typical approach health departments take for color coding ICS positions. White equals management staff, blue equals planning section, red equals operations section, yellow equals logistics section, and green equals the finance administration section. The management function consists of the DOC manager and the management staff. The DOC manager is the person in charge of all activities within the DOC. It's important to note that when the health department plays a support role, the person in charge of the DOC is referred to as the DOC manager. In the event the health department takes a lead role, such as during a pandemic, the person in charge of the DOC is referred to as the incident commander. The management staff consists of the liaison officer, safety officer, public information officer, and sometimes a subject matter expert. The management staff reports directly to the DOC manager. A complete management staff may not be needed for every emergency response. The DOC manager has ultimate responsibility for approving and implementing an action plan, allocating resources, assigning command and general staff positions, assuring that necessary management functions are activated or deactivated, ensuring that the health department's missions and goals for the incident dovetail with those of other responding agencies and jurisdictions, approving all messages that go out to the public. In addition, The DOC manager is responsible for keeping the health department's administrator or director informed about the DOC's activities and the progress of the emergency response. The DOC manager does not have to be the health department's administrator, director, or health officer. The administrator, director, or health officer may designate others to assume this emergency response function, especially if that person is unavailable or fulfilling other response duties. The liaison officer serves as the DOC manager's primary contact for other agencies that are involved in the emergency response. Liaison officers also monitor incident operations to identify any current or potential problems between response agencies. Liaison officers need to be thoroughly familiar with the ICS structure so they can determine what should be referred to the DOC manager, to other management staff, or to a section chief. The safety officer is responsible for assuring the safety of health responders in the DOC and in the field.
Everybody's using personal protective equipment. I'm going in and also look at your staff to make sure that they are not getting fatigued, they're getting plenty of water.
The safety officer assures scene safety, availability and appropriate use of personal protective equipment, basic human needs such as rest, nutrition, and hydration for staff. The safety officer should be knowledgeable about the hazards of a particular event. The Public Information Officer, or PIO, is responsible for assuring that appropriate, timely, accurate, and consistent information is provided to staff within the health department, the public, government officials, collaborating agencies. The PIO typically serves as the official spokesperson for the health department. The PIO also may brief or help prepare the DOC manager for a press conference.
Draft a release to the press with information on what the public should be doing at this point to contain the outbreak of E. coli.
Each section in ICS, Planning, Operations, Logistics, and Finance Administration, provides a key management function. The personnel within these sections are referred to as the general staff. Only those sections required for the emergency response are activated. Sections may be activated and deactivated several times during an emergency response based on the need and/or span of control. In addition to knowing their own specific ICS positions, the DOC manager, management staff, and general staff should also have a good understanding of the other positions. This knowledge of other general staff positions will aid in communication and help ensure timely, effective action. The planning section is responsible for tracking activities, personnel, and resources, collecting and organizing data, identifying strategies for responding, and reporting information to the DOC manager. The planning section plays an essential role in supporting the management staff by developing a number of documents. Among these documents are the action plan, situation status updates, demobilization plan. The operations section carries out the specific tasks necessary to meet the objectives of the action plan. Activities a health department operations section might be responsible for include conducting case investigations, epidemiological analysis and surveillance, containing disease, such as distributing vaccines or antivirals, assessing environmental safety, such as sampling water or soil for contaminants. The logistics section provides support to the other sections that have been activated. The logistics section usually is responsible for acquiring space, supplies, equipment, and outside personnel. For example, the logistics section may arrange for renting space for a vaccination clinic, delivering supplies of vaccines and syringes to the vaccination clinic, providing drivers for case investigations, ensuring that communications and IT equipment work properly, The Finance Administration section is responsible for tracking and reporting on the financial cost of an emergency response. This section ensures that contractual and financial procedures are in place to procure supplies, equipment, space, and personnel.
Personnel, time, supplies, media.
Equally important, this section ensures that all financial information is correct for federal reimbursement requests. For example, the Finance Administration section may assign time card codes to DOC staff so that the incident response costs can be easily identified in the accounting system. Depending on the nature of events, each ICS section may need to divide into one or more subsections. The Operations and Logistics sections subdivide into branches. The Planning and Finance Administration sections subdivide into units. Each subsection serves a specific function. For example, in a widespread E. coli outbreak, the Operations section might have the following 4 branches: environmental health, laboratory, disease containment, and information and guidance. When a section must open many branches or units, or many disciplines are involved in performing one function, the branch or unit may broaden further. In general, further subsections are established when the number or complexity of branches or units is greater than the section chief can control. It's important to keep in mind that the DOC will use only those ICS positions, command staff, general staff, branches, or units that are needed to respond efficiently and effectively to a particular emergency. In other words, DOC staffing is incident specific. This allows the health department to conserve resources and to use only what is needed. During an emergency, the number and types of command staff in ICS sections or branches and units that are activated may expand, contract, and even expand again, depending on the course of events. The only position that must always be activated is the DOC manager.
Job action sheets are useful tools that concisely outline the position descriptions and responsibilities for each functional role within ICS. Job action sheets, also known as position checklists, let staff know what their ICS position title is, to whom they will need to report, to whom they need to convey received information, what tasks they must complete upon coming on duty, after the immediate tasks are completed, and during the course of the operational period or work shift, which ICS forms they will need to use to perform their assigned role. Job action sheets can be amended to fit the situation by adding or deleting tasks. Lists of ICS position descriptions and responsibilities can be found on the FEMA, FireScope, and other websites. These documents provide excellent descriptions of many ICS positions. However, these documents do not address the unique roles and responsibilities that health departments may play in emergency response. For example, they do not address surveillance or mass prophylaxis activities in response to a public health emergency. As a result, many county health departments have developed their own job action sheets, and since public health staff typically use ICS only once or twice a year during training exercises, it is especially important for them to know that job action sheets are available and where to find them. Equally important, several staff members need to be capable of fulfilling multiple roles, since health departments may need to be activated continuously for 24 hours or longer to respond to an emergency. Long activation periods will require relief shifts, and no single individual will always be available to fulfill a particular ICS role. For the staff member who may fulfill the role of logistics section chief during one operational period or shift, and then fulfill the role of operations section chief 2 days later, job action sheets will be indispensable tools. Examples of job action sheets from various health departments in California and FEMA are available in the resource section. When a health department needs to coordinate its in-the-field work with the lead agency's field activities, the health department will send a field representative to a specific incident command post. Health department field representatives are largely responsible for ensuring efficient and effective communication between the health department's field operations and the DOC, as well as with the lead agency's field operations. Similarly, an agency outside of health may need to send a representative to the DOC. In this case, the agency representative would work with the DOC's liaison officer. The agency representative would play an important role in various activities, such as ensuring that resources are appropriately assigned, assisting in resolving problems, and helping with demobilization. In an emergency that involves other agencies, the DOC will need to work closely with the County Emergency Operations Center, EOC. Regardless of whether the EOC or the DOC takes the lead role, both the EOC and the DOC would be connected through the EOC's Medical and Health Branch, which is under the Operations section. The Medical and Health Branch would ensure timely information flow between the EOC and the DOC. It's also important to note that as an emergency response grows, the DOC may need to work with the Medical Health Operational Area Coordination Program. This coordinating program supports all public health and medical activities during emergencies that expand to the operational level.